I will talk a little bit about work on assets for all, a little bit of an expansive title. Let me say that to frame these brief remarks, that we started paying attention to assets quite a long time ago, about 25 years ago, I think, with the recognition that income support, which is the major idea in social policy, really wasn't adequate for various reasons. And the reasons include the following: that we live in a period now of rising inequality of income. So I think it's a major question that societies face about whether income from employment is going to support a large part of the population going forward. So in some ways, we probably have to think a little bit differently from that model. And our social policy model has been to supplement labor income with a little more income, but that's stretched in many places around the world, including the United States. The other point is, or another point is that we have evidence that when families accumulate some assets, it has effects that are independent of and distinctly different from whether families have a certain amount of income. And those effects include being able to think a little bit more in the long term, being able to plan for your future, and over the long term ending up with better life outcomes. I'll give you some brief example of that. And the third point related to the rationale for doing this is that beginning in the mid 20th century, the United States and really a bunch of other countries did begin to use social policy to build assets. This is kind of hidden social policy. It operates through the tax system. The major mechanisms are income tax benefits for mortgages, for homeowning, and tax deferrals for retirement security. So these two categories of asset accumulation are where most Americans have most of their resources, and these are highly supported by public policy, subsidized by public policy. We don't call this welfare, but basically it is. So the rationale for assets for all is that we already have social policy that's accumulating assets for part of the population, and I think it's good to ask, why don't we do it for the whole population? That was a long introduction, but I'll try to go through this pretty quickly. The strategy at the university is knowledge building. So we're testing, for example, now child development accounts, universal and progressive accounts at birth. This is a large social experiment, random assignment to treatment and control groups. This is very scientific design in the state of Oklahoma. We randomly assigned a college to the treatment group. We gave a college savings account at birth with $1,000. The participants in Oklahoma understand this to be the state of Oklahoma that's providing this account. It's actually funding mostly from the Ford Foundation, to whom we're very grateful for this work. And we follow them over time. So I'll give you some of those results later, but basically there's quite positive impacts of these kids who are now about 8 or 9 years old. So the strategy is evidence, and we'll come back to that. These are some kids at Delmar-Harvard School. Part of the SEED project actually was, we had a bunch of different projects around the country. One of them was in St. Louis, so these are just some of the local kids who were in that savings account project. Here it was called I Can Save. This was run by Beyond Housing, a community organization in St. Louis. Here's some kids in Ghana. We're running another experiment on asset building for young people in Ghana. I think it's important to note that these slides, wherever the kids are, they're kids and they look pretty much the same. And these are kids who are accumulating assets in Ghana. This happens to be in Accra. We have a McDonald partnership in Accra now. It's one of our partner universities, University of Ghana. So we're very happy to have that relationship. We have other projects around the world, but not time to talk very much about them. So this is, I was told not to put words on the slide, but I couldn't help it. I've only recently learned to put any pictures in a slide. Usually only numbers and words, But All right, so forgive me for this. These are some of the key research results from the Seed for Oklahoma Kids project, and we have found that the treatment that is giving college savings account at birth increases, of course, asset holdings, savings, and assets in those families. We have found positive expectations for education on the part of parents. So parents of the treatment group kids have higher expectations for their kids' education. And this is controlling for everything else, and with a very strong control group. Very nice experiments, very nice, good randomization, very good data collection. So we can be pretty confident about these results. So we also know that parental expectations very highly associated with how kids actually do in school, but we will be tracking that. We have positive effects on child development, especially social emotional development of children. We predicted this, but we weren't sure we would see it. So at age 4, we're finding a better social emotional development of children. That's published in JAMA Pediatrics. And overall, in a bunch of these outcomes, that all the population groups are benefiting. In fact, populations group at the bottom, the most disadvantaged children, actually have higher effects than the effects overall. So these are positive outcomes, not all of which are financial, but actually changing outlook and conditions of young people. Hopefully, as this project goes on, we'll see them do better in school and eventually graduate from college at higher levels. These research results, our experience in doing research here is that research results don't set this standard kind of statement about research project that you publish a journal article sets on the shelf. We don't have that experience. These research results from Seed OK are affecting public policy. So there's some examples here. The Harold Alfond College Challenge is in Maine. Now every baby in Maine gets a savings account at birth with a $500 deposit automatically opened. The Nevada Kickstart program is up here. Now every kindergartner in Nevada gets a savings account sponsored by the state. There's another project in Indiana going. I Have a Dream is up here. I Have a Dream is a nonprofit organization that has promised college tuition to very disadvantaged kids in very disadvantaged school systems if they graduate from high school. I Have a Dream has come to us and said, well, might it be better if we started savings accounts for these kids early in life? So we're testing this now with the I Have a Dream Foundation. This is only some of the examples. This is very lively policy development right now. We're working in a bunch of states, and as Tom mentioned, City Treasurer Tashara Jones has announced that all the St. Louis City school kids will have an account when they first come to kindergarten, and the proposal from Ferguson, and Jason Purnell, who I don't know if he's in the room, another colleague here, is working with St. Louis County to get all the county kids in, and there's some interest there. So very, very active policy development. And here, actually, this is testifying in Rhode Island. Rhode Island has also adopted children's accounts, starting with the person in front testifying. That's Margaret Clancy. She works in this building. She's on the CSD staff. You know, the faculty get all the credit for things, but actually staff doing a lot of the work. So Margaret's very knowledgeable and effective. She goes around all over the place. She manages the experiment, and then she also testifies, and she knows a lot about finance. So Margaret, and the other people up here are Willie Elliott, who's one of our PhD graduates. He's on the faculty at University of Kansas, has become very well known for this work. And Melinda Lewis is in the middle. She also a graduate from our master's program, also working in this work. So I guess the point here is that we produce not only knowledge here, but we produce students who graduate and go out and do stuff. And a lot of times they're doing very impressive work, more impressive than the professors that they worked with. This is toward Ferguson. So I'll leave you with a little vision here. You know, with information technology now, it's very, and the existence of college savings plan structures in the United States already exist. It's very easy to think about an account for every child. So that's the image that we have. In fact, you know, we're a little more romantic than that. We think about account for every child on the planet, and that may seem really out of reach, but with information technology, it's really not. So we could have, and I just pause your mind a little bit on that possibility. If every child on the planet born had an account that was connected to the internet and could receive flows of funds, what might happen? I'll leave you with that thought. Thank you very much.
Thank you.